Okay.
I am going to hit right now. Okay. So this is their, NCLEX prep, help you guys get better prepared for the boards. You all passed your predictor. And I say this all the time, the predictor is more comprehensive and it's a little harder than the boards, right? It just is. It's a fact. So that's the idea. 70 on the predictor, 93 to 99%, you're passing your boards. Unless you do nothing between the last time we were together and when you go take your boards, in which case, okay? So we're talking about potential questions the board will ask. So, and I'm gonna kind of go category by category. So with cardiac, they may show you a rhythm strips, and they may ask you which of these patients needs a beta blocker or a calcium channel blocker or DIG. Just know, that all three of them slow the heart rate down. So they would be given to somebody who's tachy, but not Brady, right? That you could give them to somebody with like a fib or a flutter, but not VFib or VTAC, because those rhythms will kill you. If you see ventricular tachycardia, which is the big, you're going to check for a pulse. That's your first action. Do they have a pulse? Probably not. And then they're going to get defibrillated. If you see VFib, which is the little, it just looks like scribble, there's nothing to check for. That's a code. You need to defibrillate them immediately, or else they're going to be dead. Okay? When it comes to other cardiac meds, remember, all of the true antihypertensive medications, which include your prils, your ACE inhibitors, right? Your ARBs, angiotensin II receptor blockers, which are your sartans, losartan, valsartan, eplerenone, which is aldosterone antagonist. Those are the three categories of true, they just lower blood pressure, but they all cause hypokalemia, or hyperkalemia rather. They all have the potential to cause hyperkalemia, okay? Whereas diuretics, except spironolactone, but the loops and the thiazides, furosemide, bumetanide, hydrochlorothiazide, chlorthalidone, all of them deplete potassium, right? And potassium is the queen mother. I say it all the time. So I don't care if all the electrolytes are off. The first one always that's addressed is potassium, because while you're fixing their sodium, they're going to have a heart attack because of their potassium being too high or too low. So make sure you understand the drugs that are potassium sparing versus potassium depleting. The antihypertensives, the ACEs, the ARBs, and the aldosterone antagonists, they are potassium sparing. They cause hyperkalemia. The loop and thiazide diuretics are potassium depleting. Spironolactone is the one diuretic that is potassium sparing. And so you may get a question. Your patient is on spironolactone and they have a new prescription for losartan. What would be your primary focus for patient education? Anybody want to give it a shot? So that they're already on spironolactone and now they have a new prescription for valsartan, which is an ARB. What kind of patient education is the most important to focus on?
A low potassium diet.
Right. Make sure they have good girl. Make sure that they understand the foods that are potassium rich that they should avoid, because spironolactone is potassium sparing. So it's going to make them hang on to potassium, and all the sartans, ARBs, are potassium sparing. So now you have two drugs on board that both make you hold on to potassium. So you want to make sure that you're instructing them about avoiding potassium rich foods and signs and symptoms that they should be looking out for. And it's all about the muscle. So cardiac palpitations, I feel like my heart's jumping out of my chest, or I feel like my heart is skipping a beat, right? That's, call the healthcare provider. A new onset of muscle cramping, Charlie horses, any of those things would be warning signs about potassium, especially knowing the patient's on a drug that potentially will cause hyperkalemia. Okay? Okay. Let's see. Cardiac, when it comes to congestive heart failure, they like to ask about nursing interventions with regard to heart failure. So in other words, understand, of course, left-sided versus right-sided and what the symptoms would be, right? That's important to understand. Remember, left is lungs, right is body. So if they have left-sided heart failure, their symptoms are going to be in the lungs. They're going to have pulmonary edema. When you auscultate, you're going to hear crackles. If they have right-sided heart failure, you're going to be worried about body, right? So in other words, jugular vein distension, abdominal ascites, peripheral edema, edema around the feet, the ankles, the lower extremities. And don't rule out periorbital edema, which is edema around the eyes, or perioral edema, which is edema around the mouth. Don't confuse that with generalized angioedema, which is an allergic reaction, if you will, to especially ACE inhibitors. They have the most likelihood of causing angioedema, which is everything up here gets swollen. The eyes, the lips, the mouth, the tongue, and then you cannot breathe, right? So that's angioedema. But with right-sided heart failure, you may see peripheral edema, abdominal ascites, jugular vein distension, and possibly some perioral or periorbital edema. You would not see, I know there was a question once that said something about like sacral edema. You would never see that. That's a very bizarre answer. So, if you see that, just go, no, not sacral edema, right? That's not typically where somebody would be retaining fluid, okay? And then interventions. So people that have heart failure, whether it's left-sided or right-sided, there are a couple things that we need to do. We're always going to treat them with some type of a diuretic, right? Because we want to make sure that they're not hanging onto any excess fluid, be it in the lungs or the body. Daily weights, not every other day, not once a week, every day, same time, same scale, right? And that's the only true dry weight. So in other words, when you get on that scale first thing in the morning, that's your weight, right? It's after you pee, before you eat. And it should be with the same, like if you wear a nightgown, always wear a nightgown. If you wear jam, you know what I mean? So you're getting an accurate weight. People make the mistake of they get weighed at their house and then they go to the doctors and there's a difference. It's a different scale. It's later in the day. They have shoes and clothes on, you know what I mean? So you're going to have a different weight. But when we're looking at people with heart failure, 2 to 3 pounds in a day, 3 to 5 pounds in a week. And that's when all the lights ding, 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 ding. That's when you have to be aware that they're in trouble and that they can wind up in the hospital, boom. And it's usually because they're not watching their dietary intake of what?
Fluids. Salt.
Salt is the devil, right? Salt is the devil. So remember that. Give me 1 second, guys. I've got a couple other students that somehow didn't see the link and they're texting me about boot camp. And I'm like, we are in boot camp. Give me 1 second. The link is in Teams. Okay. So for cardiac, heart failure, possibly AFib, possibly rhythm strips with medications. Make sure you remember those big meds, cardiac meds, which are your diuretics, your loops and your thiazides and spironolactone, beta blockers, calcium channel blockers. They lower the heart rate first, then the blood pressure. And then your ACE inhibitors, your ARBs, and eplerenone, which is the aldosterone antagonist. And they're all just antihypertensive meds. Okay. Do we have any questions so far about anything? Nope. Okay. All right. Very good. So we'll move on. When we talk about things like COPD, respiratory, when you get a respiratory type question from the Board of Nursing, it's going to be either about nursing interventions for people with COPD, the medications that are used for the chronic obstructive pulmonary diseases, albuterol. That's always, they're going to throw a question in possibly about albuterol. And that's the rescue inhaler. That's the one that you're always going to use first. That's the one that opens everything up. It works quick, in quick, out quick, right? Helps you breathe. With COPDers, the big issue is usually malnutrition and respiratory acidosis. And when we're talking about, you know, ABGs, I want to make sure that everybody understands how to decipher an ABG. It is so easy, right? So we're not going to make it more complicated than it is. Just look at the pH first. Look at the pH. If the pH is low, you have acidosis. If the pH is high, you have alkalosis. Then what kind? Is it metabolic or is it respiratory? And the way to decipher that is you look at the PaCO2, that's your carbon dioxide, right? Partial pressure of carbon dioxide. If that's high, it's respiratory acidosis, right? So the pH first, and then the CO2 and the bicarb, because the CO2 is respiratory, the bicarb is metabolic. Does that make sense for everybody? You want me to give you a couple examples?
Yes, makes sense.
Yeah, give you a couple examples to look at, because people, I don't know, but people really have a hard time with ABGs. And they're not that complicated, and you're not going to get, you know, uncompensated or compensated. That's an RN thing. So if you do decide to go on and get your RN, you know, then you'll be calling me going, can you explain that again, but with the compensated side too? So, which I will do. So when you're looking at ABGs, and I'll just give you guys like a really quick little example. I'll put it in the chat box to everyone. So you have a pH of 7.2. What's the first thing your brain says? What's going on?
Acidosis.
Acidosis.
So the pH is low, so you know the patient is in acidosis. Now the question is, what kind? So then you're going to look at the PaCO2, and the PaCO2 is 65, and the bicarb, HCO3 negative, is 26.
So is that respiratory acidosis?
Exactly.
Yeah.
You see how high that PaCO2 is?
Mm-hmm.
Right. So as the first thing you do is it acidic or is it alkaline? The pH tells you that. You don't have to look at anything else. You know if it's acid or alkaline by the pH. Then is it respiratory or is it metabolic? In this case, the CO2 is way elevated. This is, by the way, what happens to somebody with COPD. This is the kind of an ABG you would see, but you'd probably see that CO2 up to like 100. And then their oxygen, their PaO2, which is normally 80 to 100, you'll see that sometimes like 50, 54, super low. Because what's happening is they're hypercapnic. So they're hanging on to all the carbon dioxide and there's no room for oxygen. So when people with COPD pass away, respiratory acidosis is what kills them. That's why they die. Okay. Any questions about this so far?
No.
No. Okay. So now if you look at the pH, and it is, let's do one more, 7 point, pH is 7.31. What's going on?
Alkaline.
So here's the thing. Remember, you got to memorize these numbers. So a normal pH is 7.35 to 7.45. That's a normal pH. So what is 7.31?
Acidosis.
It's low, it's acidosis, right? So, and then to remember the numbers more easily, I do them in this order. Let me just show you the numbers, the correct numbers. So that's the pH, the PaCO2. Here's the way to remember it, because it's 35 to 45. Do you see? So you can't forget it. 735 to 745, 35 to 45. That's an easy way to remember it, right? So that's the pH, that's the carbon dioxide. The bicarb, the HCO3 negative, is 22 to 26. And then the PaO2, which is the partial pressure of oxygen, is 80 to 100. Okay, so those are the normal numbers. So 7.31, we know they're in acidosis. So now the question is, what kind of acidosis, right? So you're going to look at the carbon dioxide, and their PaCO2 is 35, and their bicarbonate is 'the pH is 731, so it's acidosis. Is the CO2 normal, low, high? 35, is that normal?
Normal.
Normal.
So the respiratory is not an issue, right?
Yeah, so it's
No.
metabolic.
Metabolic.
acidosis.
Right, when you look at the bicarb is low, 21.
Miss
So
Mary, we don't look at the O2 levels then, correct?
I
When
mean,
put them in?
you can, but again, when you start getting into, compensated versus not, if somebody's in respiratory acidosis, if they give you all the numbers, it's just that the O2 is going to be low,
Okay.
but the things that help you decipher it at this level are the pH tells you whether it's acidic or alkaline, and the CO2 or the bicarb. Is it respiratory? Is it metabolic?
Okay.
That's
Right.
it. That's it. It's that simple. Like, don't make it complicated. Everybody cool?
Yeah.
Okay. Any questions? Anything else you want me to go over with regard to that? No. Okay. When it comes to lab values, since we're talking about lab values, make sure that you know for warfarin, what labs are you looking at?
PTT and
INR.
INR.
How soon they forget. PTINR, right? PTINRs for warfarin. PTT or APTT is for heparin. And the way to remember it is when you look at PTT, people say the two T's together look like an H, and H stands for heparin. So if that helps you, fine. The PTT is for heparin, the APTT is for heparin. Warfarin is your PTINR, international normalized ratio. And if they're on warfarin, what should it be?
2 to 3.
2 to 3.
Johnny, tell them what they've won. 2.0 to 3.0, right? And they will, almost every single student has gotten a question about an antidote. The patient's INR is 5.2. The nurse anticipates that the physician will order which of the following medications?
Vitamin K.
Vitamin K.
Right. And what's the other name for vitamin K? You'd recognize it, wouldn't you?
Something or other.
Wouldn't you recognize this word? Wouldn't you recognize that word?
Yep.
Yeah.
Phytonadione. That's vitamin K. Right? So going to give them vitamin K if their INR is high, warfarin. If their heparin, if their PTT is too high, what would you give them?
Protamine sulfate.
Sulfate.
Protamine sulfate, right? And every student that has remembered has said to me that both of those were in other words, the answer choices were vitamin K, phytonadione, protamine sulfate, and then they throw in like acetylcysteine or, two other distractors. But they do that to make sure that heparin, protamine sulfate, warfarin, vitamin K. Like, don't screw that up, right? That's an easy question. Okay. All right. And then, of course, when it comes to antidotes, some of the other ones that you need to know: acetaminophen, acetylcysteine, right? And acetylcysteine, right? And it even starts with an A, right? Digoxin is so easy because the name of the antidote's right in the antidote. Digibind, right?
Yeah.
It starts DIGI, just like digoxin, you know what I mean? So that's an easy one to remember. Pregnancy, magnesium sulfate, antidote.
Calcium gluconate.
Calcium gluconate. The way to remember that, remember my stupid little line. When you think potassium, you think muscle. When you think magnesium and calcium, you think nerves. So think about it. Mag sulfate stops the seizures. If we give you too much, we dull your nervous system. So we give you calcium gluconate to balance it back out. Calcium and mag, nervous system activity. Potassium, muscle activity. Just remember that. That'll help you answer a lot of other questions. Okay, it really will. Okay. Let's see. When it comes to herbals, they've been asking about glucosamine and chondroitin. So let me throw you these. So glucosamine and chondroitin. I think it's IN. I think that's spelled right. At any rate, those drugs are for, arthritic pain, if you will, joint health. Okay, joint health. So, they're full of shit. They don't do anything. But the point is that's what they are typically, used for. Glucosamine, chondroitin, people with arthritic pain, not rheumatoid arthritis, osteoarthritis, where they have stiff joints, aging, right? They say it promotes joint health. No evidence to prove any of that, but, that's what they say. And then topical capsaicin. And it's made from hot peppers. It's a topical ointment. And it actually, when you put it on, it gets hot. That's also used for arthritic pain. And the big thing with that, don't get it in your eyes. Make sure you wash your hands or wear gloves when you put it on, because if you go to touch your face, oh my God, it burns. Literally, it's made from hot peppers. Okay. So those are the ones the board has been asking about. I'm only the messenger, can't tell you why. Okay.
So is it just asking us what they're used for?
It'll be a scenario like, you're a nurse working in the clinic and the client comes in wanting some kind of an herbal, that can help them with their osteoarthritis. The nurse knows that one of the widely accepted one, and they'll word it like that, like a widely accepted herbal remedy would be glucosamine, chondroitin, or capsaicin as a topical.
Okay.
And the ones that I talked about before that are in that little cheat sheet that I made, like farm antidotes and yeah. So, the herbals that you want to know about, melatonin is another one, because what they do is they base their questions, a lot of them based on what is, what's popping, right? So a lot of people are using melatonin, and there are a lot of people out there that love herbals, right? Not me. Well, and I don't, because here's why. There's no oversight. So if you buy a bottle of melatonin and it says, I don't even know how it's dosed, to tell you the truth, because I don't do herbals, but let's just say it's dosed in integrated units. So if it's 1,000 per capsule, I don't know if it's 1,000 per capsule, because there's no oversight to make sure. Could be 1 unit in a capsule, could be 10,000 units in a capsule. And there's no empirical evidence to support a change in condition with these herbals. That's the big thing. Some people just swear that they work, but it's like a placebo effect, right? If you believe something works, even if it does nothing, it works. You follow what I'm saying? So there's no evidence for any of these herbals at all to prove one way or the other. I even looked up the glucosamine because of my dog and her arthritic issues. And I looked in the Merck veterinary manual, and I went to every peer-reviewed journal article for veterinary medicine, study after study, and their conclusions were all the same. There was no marked difference in the dogs that were taking the glucosamine supplements versus the dogs that were not. And again, comparing apples and apples, dogs of the same age, the same size and weight and stuff like that. You know what I mean? No difference. So there's no evidence to support herbals. That's the problem that I have with them. It's not that I'm against natural things. I mean, that's natural. I don't have a problem with that. Yeah. But you get the point, right? So, you have to be careful too, because a lot of these herbals, interact with pharmaceuticals. And that's where the problems typically come in. So just remember when it has to do with anticoagulants and bleeding issues, remember the herbals that start with G, the herbals that start with the G's, they're the big ones. Garlic, right? Garlic will make you bleed more. Ginkgo biloba, ginseng, ginger. The herbals that start with the G's, for some reason, coincidence, are the ones that are contraindicated if the patient's on any kind of an anticoagulant or an antiplatelet med. So just remember, so ginger, garlic, ginkgo biloba, and ginseng. And do you guys remember what those are for? Like, what's ginger used for? What do they say ginger does?
For nausea.
Nausea. Ginger, they say for nausea. Garlic,
I just love garlic and everything.
but
Just
eating
for
garlic.
cholesterol.
With your heart or something?
Yeah,
The
I don't mean,
cholesterol?
yes, it's cholesterol. I don't mean eating garlic. I mean taking a garlic pill supplement, right? I
It's
eat
supposed to
garlic
lower
like
your blood pressure.
it's for cholesterol. Lowers your cholesterol. Yep, garlic supposedly, and actually there is some empirical evidence that the Mediterranean diet, which includes a lot of garlic, my people love garlic, you know, they tend to have low cholesterol. You know, but I don't know about it in a pill. Like put some garlic in your food, you know. Ginkgo biloba, what is that for?
Memory.
It's for memory, right? Huh? No, kidding. And ginseng is for like anxiety.
Stamina, right?
No, ginseng's for like anxiety, stress, anxiousness, nervousness, right? Ginseng is like, ooh, calm you down. Okay.
Yeah, for anxiety.
Yeah. Yeah. Wait 1 second. The sun now. What, Christopher? Okay, deal with him in a minute. Yeah, I'm going over there around 12:30 to go see this grandchild of mine for the first time. All right, so what else?
You get to hold her and touch her.
Yeah, or I'll slice somebody's throat. Yeah. Yeah. Okay. Now, and again, people tell me what they remember from when they take their boards. So what I'm looking at over here are text messages, lists, and things that have been sent to me from students who have just taken their boards of what they remember. If you're allergic to latex, what else are you allergic to?
Bananas and kiwi or something like that?
Rachel, you're batting 1,000, honey. Yes, ma'am. Bananas and kiwi. Yes, ma'am. There were questions about alcohol withdrawal interventions. So if somebody is in withdrawal, that's an alcohol, you know, habitual alcoholic, what are the symptoms of withdrawal and what kinds of things would you as the nurse have to do? So remember, whatever the thing is that they're addicted to, whatever it does when they're on it, it's going to be the opposite when they're withdrawing, right? So alcohol is a central nervous system depressant. When they're coming off of it, they're going to have tremors, shaking, right? They're going to be at a risk for at a risk for seizures, right? So you're going to implement seizure precautions. And what is the drug of choice for alcohol withdrawal?
Does it start with a C?
It does. It does.
I can't remember how to say it, Miss Mary.
I know, it's all right.
It's
This
like
is something that I started with my term 3
Hexaron.
students. I'm making term
Chlordiazepoxide.
chlordiazepoxide. Now
There
what
you
I'm
go.
doing is I'm making my term 3 student, I'm like splitting them up and I'm making them say the words out loud, like, so that I know everybody's saying them. Because when I say, come on guys, say it with me, there's always a few people that say it and a few people that are like, they do that. Like she can't hear me, so she doesn't know if I'm saying it or what. So anyway, chlordiazepoxide, benzo. when you think about benzodiazepines, that's your alprazolam, lorazepam, diazepam, temazepam, chlordiazepoxide, right? They're the chill pills. They're for anxiety, right? But they're also used for alcohol withdrawal. And when you give it IV push, what will it do with a seizure? It'll stop a seizure. Don't forget that, because that's another question. Somebody's actively seizing for more than 5 minutes, nursing intervention is going to be IV push, either lorazepam or diazepam. That's the only thing that's going to make it stop. Right? Okay. So HIV, AIDS, pacemaker. Yeah, and then I'm going to start wrapping this one up soon. Okay, so, and labs, somebody with cirrhosis. And I know how much all of you love GI, because I remember how GI was just your favorite thing. So if somebody presents with cirrhosis of the liver, what labs are you going to be looking at and what are they going to be doing? Right? So just remember, cirrhosis of the liver, when you're looking at the liver, AST, ALT, there's a lot of A's, AST, ALT, ammonia, right? Bilirubin, those are going to be high. But the only one that's going to be low, albumin. Right, very good. They're protein. They're typically going to have low protein, right? So they're going to have elevated AST, elevated ALT, elevated ammonia. When the ammonia levels are elevated, what happens?
Causes, there you go. It crosses the blood-brain barrier.
And causes hepatic encephalopathy.
Encephalopathy.
There you go. You did it. Beautiful. Encephalopathy. Encephalopathy. Encephalo is the brain. Hi, kitty cat. I love that the cat's like, I want to see what's going on. Like, let me see what's up. I'm surrounded. Like, I have, the dog is on the floor behind me, and I've got like 3. I'm the crazy cat lady now. I have 5 friggin' cats, which is like 4 too many, but it's a long
I
story.
know somebody that has more than you.
Oh, yeah, and I know who she is too, that has way more than me, like 15 or 20 cats.
Really?
Yeah. That's a lot of cats. Anyway, all right. Let's see.
Are there going to be questions about dumping syndrome?
If they ask you a question about it, it's going to be straightforward. What do you tell the person to do? Don't drink with their meals and lie right down after you eat.
Okay.
That's
right.
that's it. That's it. It's not, I'm telling you, and you'll see when you take the boards, as long as you know the base information that I've been hollering and yelling at you guys about for as long as I've known you, you are fine. It's the people that don't remember, like, what's the PTINR, what's a normal hemoglobin. That's why I'm like constantly, Those are the things that you have to remember and know, you know, but the questions are much more straightforward, if you will, than the ATI questions tend to be a little more complicated, and the Saunders are even more complicated. That's why it's good to do the Saunders, because they will make you work your brain. You know, it's good for the brain, good brain exercise.
Gotcha.
Okay. Make sure you know your insulins. This is another common. Almost every student has told me they've had at least a question or two about either insulin, mixing insulin, administering insulin, something to do with insulin. And then there's going to be questions about diabetes mellitus. Okay. So when it comes to insulin, just make sure you remember, you know, the way I remember it in my head: Lispro, rapid, regular, short, NPH intermediate, Glargine, Detamir, long. Like I can picture it in my head when I say it to you, right? So, and I remember it in that order, so I know which insulin, you know, what's the onset, what's the peak, right? What's it mixed with? What can it be given with? So remember, the only insulin that's given IV is
Regular.
Say it like you mean it. Regular.
Regular.
Regular insulin is the one that is used to treat diabetic ketoacidosis. So they will be on an IV insulin drip, as well as IV electrolytes and IV glucagon, sugar, because to get them back where they were before DKA is difficult, right? That's a life-threatening situation. So regular insulin is the one that can be given IV. All insulins are given subcutaneously, right? And remember, the long-acting insulins, which are your Detamir and your Glargine, they are given once a day, typically at night. They're not mixed with anything, right? They are given by themselves. The only insulins you can mix NPH with regular, you can mix NPH with Lispro, the end. And all you have to remember is that Nancy Reagan RN or Nicole Ritchie or however you want to remember it. And it's NPH air, regular air, and then regular drop the insulin and then drop the NPH insulin last. NRRN. You may get a question about that. Diabetic foot care is another one they love to ask about. Make sure you remember, they should never be cutting their toenails. Neither should you be cutting their toenails. They can use an emery board, a soft emery board, but that would be it. Otherwise, they're supposed to go to a podiatrist, right? They can lotion their feet, absolutely, but not between the toes. They should never soak their feet, right? They should never soak their feet. I'm going to pause the recording 1 second. Let me just grab, this is my daughter. The other thing, diabetes insipidus, not to be confused with diabetes mellitus. With diabetes insipidus, if you get a question about it, it's going to be either about what is the test they would use, water deprivation test, right? Remember, diabetes insipidus, waterfall. That's the one where all they do is urinate, right? Y'all remember that from term 3?
Yes.
Yep.
Okay. So diabetes insipidus, the test would be the water deprivation test, right? They like to ask about sterile field. They like to ask about indwelling urinary catheter, and they like to ask about NG tubes, okay? If they ask about these things, it's going to be a procedural, usually a procedural question. In other words, like, you know, they'll do one of those, put the steps in order. And by the way, the NCLEX is changing. So you guys are just catching the tail end of what it's been. It's going to change by May or June of this year. And they're going to be a higher level of cognition questions, and they're going to be you won't have drag and drops and hot spots and those kinds of questions. It's going to be either select all that apply or multiple response or multiple choice. So it's not that they're eliminating those kinds of questions. So you guys are on the tail end of the ones that I'm very familiar with. So you're lucky. So in other words, don't delay, right? Don't delay, please. The longer you wait, the worse it is.
I'm just waiting for that email.
Waiting for the ATT number. I understand.
That's
Everybody's
it.
registered, right?
Mhm.
Yes. I just got my email a few days ago for my fingerprint, so I'm scheduled for that.
Beautiful. Yeah, please, guys,
Me
like,
too.
don't.
I go Tuesday.
Good. Yeah, don't delay. The longer you put it off, people think, I need more time. I need more time. No, you don't. No, you don't. Because the longer you wait, you're going to forget stuff. You want to do it while all this crap is fresh in your mind. Okay, trust me. Okay, you got it. So far, have I been wrong yet?
No,
Nope.
No.
So,
you really haven't.
like I keep telling you guys, you know, you have no choice but to trust what I'm telling you, and you'll find that I am right about these things. Not about everything, but about these things. So diabetes mellitus foot care. There may be a question about renal with regard to dialysis. They like to ask about either hemo or peritoneal dialysis. If they ask about hemodialysis, 9 times out of 10, it's going to be about the AV fistula. And it's going to be like, feel the thrill, hear the bruit. I'm telling you, like, they like to ask that. There have been more questions about when it comes to psych, mental health nursing. Just remember schizophrenia. the positive and negative symptoms of schizophrenia. The positive symptoms are the ones that you can see: hallucinations, delusions, and bizarre, disorganized, weird behavior, right? And a flat affect. And then the negative symptoms, the 3 A's: alogia, I have nothing to say; anhedonia, I have no joy; and avolition, I got no ambition, right? And remember, with the psychoses, which schizophrenia is, antipsychotic meds all have the commonality of causing extrapyramidal syndrome. So that's, you know, all your antipsychotics: haloperidol, quetiapine, Respiratory, chlorpromazine. They all share that commonality. Chlorpromazine is more likely to cause agranulocytosis than EPS, but they can all cause EPS. What is the treatment for extrapyramidal symptoms or extrapyramidal syndrome? There are 2 meds that can be used to treat it.
Cogentin and Benadryl.
There you go. So it's cogentin is benztropine, and Benadryl diphenhydramine. They are the 2 medications that are used to treat and sometimes even prevent EPS if the person's on an antipsychotic med. Nursing interventions as far as therapeutic communication, they like to ask about that. Just remember, don't ask why. Don't minimize or blow off what they're saying, like, oh, don't worry, you'll be fine, right? Those to me are mostly common sense. Right? And then delegation, they like that. And people have been saying, oh, I got a lot of questions about delegation. I mean, was it a lot? When people take their test, if you don't like delegation, it's in your mind, you had 1,000 delegation questions. You know what I'm saying? So the point is that a lot of people have been saying, like, there were delegation questions. Just remember, you don't delegate whatever you can eat, right? You can usually figure out the answer to these just by looking at them and by the power of deduction, right? So, you know, which of the following aids would the nurse delegate, or which of the following tasks would the nurse delegate to the unlicensed assistive personnel? So, you know, they can do enemas, they can do finger sticks for blood glucose, they can do vital signs, they can take care of stable patients, but not unstable patients. In anything that's task oriented and specific. You know, it shouldn't be go down there and ambulate Mrs. Jones. It should be after breakfast, ambulate Mrs. Jones from her bed to the end of the hall once and then back again, and then let me know how she did, right? It's got to be specific because they can't evaluate, they can't teach, right? So when you're looking at the answers that are given to you, just say to yourself, you know, if it has to do with reinforcing teaching or education, no. Dressing changes, no. Tracheostomy care, no, right? And if they give you a result of a vital or a blood sugar that's crazy, you do it. You go behind them and you do it to make sure that it's correct, right? Nursing ethics, it's going to be either like veracity or non-maleficence. They're the big ones for the boards, right? Just tell the truth, don't lie, right? And do no harm. When it comes to HIPAA, just understand that the only people that should be able to have access to any protected information are the ones actively involved in the patient's case. That's it. So if it's, you know, if it's the chaplain and the chaplain's involved, yes, the chaplain has access to the chart. Social services, physical therapy, OT, ST. And remember what they do. Physical therapy is all about the lower body. It's transfers and walking. Occupational therapy is more upper body. Eating, cooking, bathing, shampooing your hair, brushing your teeth, those kinds of things are OT. And speech language pathology, swallow evals, and also speech, you know, speech therapy. Okay. Let me see, let me look at my other list one more time, make sure that I am not forgetting. Yep, left-sided heart failure, which we talked about. I'm looking at this other person's little list. Administration of ROGAM. So this one, she remembered a lot. This is beautiful. Just remember, with the ROGAM injection, if the mother is negative, if she's negative, right? And she's probably going to need the RH shot. And the RH shot, there's 2 injections that are given, one at 26 weeks and one 28 weeks and one right after birth. And that's if the baby, it doesn't affect that pregnancy. But if you're negative and the baby has positive blood, there's some blood that exchanges during delivery. And your body will build up antibodies to that positive blood. So if you get pregnant again down the road and that baby is positive, you will miscarry because your body, your white blood cells will attack that embryo. They'll see it like a threat, a foreign object. And remember the newborn, remember immunizations. They're the other big ones. Newborns, vitamin K, vastus lateralis for coagulation, erythromycin, ophthalmic ointment in the eyes to prevent conjunctivitis. Remember your hepatitis B they get before they leave the hospital. Annual flu shot from 6 months on. The 5 that are live, MMR, varicella zoster. Yep, ABGs. Clean catch and removal, doffing of personal protective equipment, donning and doffing of PPE. Donning is putting it on, doffing is taking it off. When you're removing PPE, just remember the dirtiest thing comes off first. That's the gloves. The gloves are always the first thing off. Okay.
Miss Mary. Miss Mary.
Yes, Betty.
Oh, I was just saying for just to help everybody else. I was listening to somebody, and for downing off PPE, just go by alphabetical order. I believe is the order that helps you remember how to take it off.
So, I mean, if you have on gloves, gown, goggles,
gown.
mask, they're all G's, but I mean, that does kind of work. You know what I mean?
Yeah, I forgot who I listened to, and they basically were saying just remember alphabetical order. It
Okay.
helps you remember how to take them off.
All right, and that's actually not too bad, right? Because gloves, gown, mask, goggles, gloves, gown, goggles, mask. Yeah, all right, it does work. So, all right, very good, thank you. And what else? Bucks traction. She had a question on bucks traction and skeletal traction, which is unusual, but so bucks traction, remember, is for relief of muscle spasms while the patient is waiting to go into surgery for an ORIF. They've broken their hip. We put them in bucks traction to relieve muscle spasms while they're waiting for the OR. Skeletal traction is for immobilization or healing. That's what they're going to be in if they broke their femur, right? They can have an external fixation device like a rod holding that in place, and that's going to stay in for 6 weeks, 8 weeks. Whenever there's an issue with traction, just remember, don't touch the weights. Don't touch the weights. The weights have to be free hanging. They shouldn't be touching the floor. And questions about post-operative hip arthroplasty. Just remember, no 90-degree bends, no crossing of the legs. They should be elevated toilet seat, elevated seating, right? Preeclampsia. And she had quite a few, as far as her memory goes, quite a few questions about transmission-based precautions. So if a person has tuberculosis, what kind of transmission-based precautions do you use?
Airborne.
Airborne. If a person has pertussis.
Droplet.
Droplet. If a person has impetigo.
Contact.
Impetigo, they used to call it hand, foot, and mouth disease. Right?
Oh.
Impetigo, that's contact. Scabies is contact. Lice is contact. Varicella.
Airborne.
Contact?
Both. Varicella is airborne. Remember, I want my MTV. Airborne is measles,
Yeah.
TB, varicella, right? But when the
Yeah.
vesicles are oozing, it's contact also.
Right.
Okay, so it's
Ew.
always airborne, but it's contact if it's oozing. And any kind of pneumonia. It doesn't, like, don't get nerved out if they say pneumocystis pneumonia or mycoplasmic pneumonia. Whenever you see pneumonia, it's droplet. Right? Makes sense? Because it's respiratory. Doesn't matter what the name of the bacteria is that's causing the pneumonia. You follow? People sometimes will see the word like pneumocystis pneumoniae and they'll be like, oh my God, it's still pneumonia. So it's droplet. Right? Okay. Yep. Okay. Antidote for acetaminophen. We talked about that. Yep. Don't forget about the a stress test versus a non-stress test. And treadmill stress test is a cardiac test where they hook you up to vital signs and an EKG and you get on a treadmill and you walk and then you run and they want to see if there are any changes in the EKG. A non-stress test is when you are pregnant and they want to see fetal movement. They give you a little button that you push every time you feel the baby move or kick. That's a non-stress test. And then when it comes to maternal newborn, just go over the fetal heart rate monitoring. Right, that's the other thing. And I actually I'll put it up again. I added to my maternal newborn PowerPoint, like little cheat sheets. So I'll put that one up for you guys. Just remember veal chop, variable, early, accelerations, and then late. Because accelerations are good. If the baby's heart rate goes up, that's okay. It's the decelerations that are problematic, right? And I think like that's enough for one day because we just covered a lot of stuff. Anybody have any questions they want to ask?
No, Miss Mary, I don't.
I'm going to stop the recording. So hold on a second.